my dosage. In my dosage and the drug name Benadryl, dosage 25 millimeters, 25 milligrams, 10 per 10 millimeters, and then my initial, and then I'll put it on the cup right here. So it's labeled right here. Now that we've labeled that, we'll proceed to do our second check. So our second check, we're gonna compare our label of the cup, our label, our medication, our MR. So first off, I'm gonna verify my patient again. So patient ID 4545, name Tom Ford, date of making sure on my label it's also said Tom Ford on it. Date of birth 24th June 1938, and Dr. R. Brown. Okay, so now I'll go to verify my check my medication. So Benadryl, 25, and then Benadryl on my label, 25 25 milligrams per 10 millimeters, and here it says 12.5 milligrams per 5 millimeters, but I already calculated that, and we got 10 millimeters here. So here in the cup we also got 10 millimeters. I'm making sure that we got 10 millimeters on here, looking at eye to eye, and also I have the right dosage on here, the right labeling of dosage, and orally every 4 hours as needed. Okay, and orally 4 hours is needed. Okay, so now that I have done my second check, I'm also doing the same thing for my third check. So patient ID 4545, name Tom Ford, date of birth 24th of June 1938, and Dr. R. Brown. And here we're also checking the label to make sure that it has Mr. Tom Ford's name. Okay, good. So now I'll do my my check for my medication. So Benadryl 20 Benadryl liquid, 25 milligrams per 10 millimeters, and here's at 12.5 milligrams per 5 millimeters, but I already calculated that, so it's 10 millimeters. And then we're also checking here on our cup that we got 10 millimeters. Okay, good. And then dosage 10 milliliters, orally every 4 hours as needed. Okay, now that I have done my first medication, I'm gonna do the second one. So we're gonna put this away here, and then we're gonna get our, and we're gonna do our, we're gonna pull out our Bactroban. So we have here is our Bactroban. I'm gonna compare the medication to my MAR. So first off, I'm gonna do my first check. Patient ID 4545, name Tom Ford, date of birth 24th June 1938, Dr. R. Brown. Okay, now that I have verified my patient, I'm gonna do my check on my medication, my 5 checks. So the name of the drug, Bactroban, and 2% ointment topical. And sorry, I forgot to mention that I have to check my doctor's order. So first off, I'm gonna start. So first off, here we got our doctor's order. Oh, sorry, not the doctor's order. Never mind the doctor's order. So we got the drug name, Bactroban, ointment topical 3 times a day, ointment topical 3 times a day, and as needed. And I also forgot to mention that the expiration date for my Benadryl. So I'm looking back. So my expiration for my Benadryl is June 30, 2030, and it is good to go, and it is being administered to Mr. Tom Ford at 7 18th of June 2020, and I'm checking here if it has been administered, and so far it hasn't. Okay, now I will continue from where I left off on my Bactroban. So I'm also checking that this medication is being administered to Mr. Tom Ford at 7 in the morning, and I'm checking if it has been administered, and so far it hasn't. And the expiration date of this is June 30th, 2030. Okay, now that I have done my first check, I will now label my medication. So I will label the patient's name, the drug name, and the dose, which is 3 times a day, and my initial. So now that I have labeled that here, okay, and now that I have labeled my Bactroban, my medication, I will now proceed to do my my second check. So patient ID 4545, name Tom Ford, 24 date of birth 24 June 1938, and the doctor is Dr. R. Brown. And now Bactroban, dosage 3 times a day, and ointment topical, and as needed, and expiration date is June 20, 2030, and being administered to Tom Ford at 7 in the morning at 18 June 2020. Okay, so I will now put everything on my tray. So back to pan, and then I will get my more. I will now go to my patient's room. So now that I'm in my patient's room, I'll knock, provide privacy, and then I'm gonna say, hi, I'm back. So then I'm gonna raise the bed on my working height position, side roll down, and before I'm gonna identify my patient again, I'm gonna apply hand hygiene, and I'm gonna ask, can I have the wrist, please? Yes, you can. And can I ask your name, Mr. Tom? Can I ask for your name? Yes, my name is Tom Ford. And what's your date of birth, Mr. Ford? 24th of June 1938. Okay, now that I have sorry, I forgot to mention that as I verify my patient, I'm also looking at my MOR, so I'm just gonna do that again. Can I get your name, please? Yes, my name is Mr. Tom Ford. Mr. Tom Ford. Okay, and what's your date of birth, Mr. Ford? June 24, 1938. June 24, 1938. Patient ID 4545. Okay, good. So now that I have verified my patient, I'm gonna I'm gonna tell him about the medication. So Mr. Ford, do you know anything about Benadryl? No, I don't. So Benadryl is pretty much, it's to treat your allergies, and the symptoms of this is that you may feel drowsiness, headache, or you can have a dry mouth as well. And with this, you can prevent it by having a proper oral hygiene, and also frequent rinsing of your mouth. Okay, now that I have told him about that, I'm also telling him. To. I'm gonna ask him if this is all okay for him. So is it okay if I administer this medication to you? Yes, it is okay. So, but before I administered that, I also forgot that before my patient teaching, I also have to verify my medication after my verification of his name. So I'm gonna do that. So first off, we got here is our Benadryl. We got 25 milligrams per 10 millimeters, and we got 10 millimeters here in the cup orally every 4 hours as needed. And then here we got our Bactroban. It is an ointment topical. So Bactroban, dosage 3 times a day. Okay, good. As needed, as needed. Okay, now that I've done that, and now that I have also done my patient teaching, I will administer the medication to him. So first off, I'm gonna apply hand hygiene, and then I'm gonna give Mr. Ford water to make his to make the swallowing at ease. So here, Mr. Ford, here is your water. Okay, so now you drink it. So I have verified his swallowing, and it is good. And when I verify that, I'm gonna administer his medication now. So Mr. Ford, is your medication, and just drink it all up. Okay. Now that he drank it all up, I will now do my I will ask him of how he feels. So Mr. Ford, how are you feeling? I'm feeling well. Mr. Ford is feeling well. Now I'll proceed to do my second medication, which is Bactroban. So Mr. Ford, I will now proceed to do your second medication. And do you know anything about Bactroban at all? No, I don't. So it's pretty much an ointment that prevents infection or bacteria from growing. You may feel like burning or stinging or pain, and in able to prevent infection, you have to do frequent hygiene and wash your hands more frequently to prevent contamination and infection. So, and I will also say that for my teaching that don't Mr. Ford, don't touch the site. That is, don't touch the site or play around with it. Don't scratch it if it's itchy or anything like that. Don't take off the medication on the site. And also, I forgot to mention, don't take off the medication and stuff like that on the site. And now I will ask the right to refuse. So Mr. Ford, is this all okay with you? Yes, it's all okay for me. Okay, now that I have done that, I'm gonna administer his medication. So first off, I'm gonna apply hand hygiene. I'm gonna apply gloves because I'm touching Mr. Ford right here. So is it okay if I touch you, Mr. Ford, on your left arm? Yes, it's okay. So now, first off, I'm gonna clean the site. So I'm gonna grab a towel here. I'm just gonna use my pillow as a towel. So I'm gonna grab towel, a wet towel, and then I'm gonna wash the site. And then once I wash the site, I'm also grabbing a new towel to dry the site. And first off, I'm gonna dispose my gloves and then apply a new gloves. And then as I apply my new gloves, I also have my new towel, and it's a dry one. So I'm gonna dry the towel. I'm gonna dry the site. So as I do that, I'm gonna apply my medication. So I'm gonna dispose my gloves that I use and apply new gloves, and then I'm gonna put a medication on my gloves, and I'm gonna wipe it into his left arm gently, applying it gently and not applying any pressure on it because it will hurt. So now that I have done that, I will dispose my gloves, and then I'm gonna dispose my gloves and wash my hands, and I'm gonna ask how he feels. So how are you feeling, Mr. Ford? I'm feeling well, but it's a bit it's a bit stingy. I could feel the itchiness and the stingy, and it's a little bit painful. Okay, now that I have asked him about how he feels, I'm gonna come back to check on him. So Mr. Ford, um, if you need anything else, just let me know, and I'll come back around 30 to 45 minutes to check on you. So if you need anything, the call bell is here into your right side, and just press that, and any nurse will come for your aid. And so I'm gonna lower the bed in the lowest position so it doesn't fall, and then side roll up, and I'm gonna leave the privacy on for Mr. Ford. And now I will leave and do my documentation. So I'm gonna do my documentation, and I'm also gonna sign in my MAR. So my MAR is here. So this is at 7 in the morning. And now that I have signed in my MAR right here, it's been 30 minutes or 45 minutes, and I will go and check him. Hello. So, knock knock, applying hand hygiene. Hello, I'm back, and I'm gonna identify him again. So, with my MAR, so first off, I'm gonna raise the bed on my working height position, and then roll down, and then apply hand hygiene, and then I'm gonna do my verification. And I'm gonna grab his wrist. So can I have your wrist, please? Yes. And can I get your name, please? Tom Ford. Okay, Mr. Ford, when's your date of birth? 24th June 1938. Okay. Dr. Trajinki. Patient ID 4545. Okay, good. So now that I have identified him, I will reassess his. I will check how's the medication affecting his left arm. So far, there is still some. There's still a bit. There's still a bit. He states that it feels a little bit itchy now. Swelling still remains. It remains unchanged, and there is still some redness a little bit on it, and irritation on the skin, and also and he said that it's also warm to touch. And Mr. Ford, can you rate your pain for me right now? It's 1 out of 10. Okay, his pain is around 1 out of 10. And I'm also gonna reassess his vital signs, and I'm also gonna reassess his vital signs. So his blood pressure is now 125/88. It went down a little bit, but it is still a little bit higher than the usual range, which is not 120 of systole and 90 for diastole. And his respiratory is 16 beats per minute, and it is non-labored and deep, and within the normal range of 12 to 20 beats per minute. Also, his O2 sat is 98%. It remains the same. And it's within normal range of 95 to 100%. And his heart rate went down by 80 beats per minute, and it is still within the range of 60 to 100 beats per minute. And his temperature also went down to 37.1 by a little bit, but it is still within the normal range of 36 to 38 degrees Celsius. So now, I've done that. I will ask. I will tell that Mr. Ford that if he needs anything else, the call bell is here within his reach. The call bell is here in his right side, and Mr. Ford, if you need any help, the call bell is here in your right side, and just press that one. Just let me know if you need any help or if you have any questions, and any nurse will come for your aid. And if you feel any pain at all, or if you feel any pain or symptoms due to the medications, just let us know, and we'll come right away for you. So I will thank the client. Thank you, Mr. Ford. So now I will lower the bed on my on the lowest position, side roll up to prevent fall. Applying hand hygiene. then opening the privacy for him, and then I'm gonna go and proceed to do my charting document.